Well, it's stinging your eyes, affecting your lungs, affecting fertility and doing more as far as your heart health is concerned. Air pollution is not just about your lungs. It's affecting every single organ of your body. But we only talk about it when it starts to bother us in the winter months. The most authoritative voice as far as your lung health is concerned, well-known pulmonologist and former director of AIIMS, Dr. Randeep Guleria, is now joining us. So thank you so much for your time. I want to ask you, people talk about breathing problems, stinging eyes, water from their eyes, and these problems during air pollution months. But there has to be just so much conversation of how much damage that dirty air does to every single cell of our body, isn't it?
Yes, that's true. So if you start looking at
Yes.
data and studies which have been done, research which has been done, air pollution, especially the fine particulate matter 2.5 and ultra-fine particulate matter less than zero point 0.1 micron, they not only reach the lungs, they are able to cross from the lungs into the bloodstream and go to all parts of the body. They cause inflammation or narrowing of our blood vessels, higher chance of heart attacks, and it's been seen in various studies that they can lead to dementia, they can lead to affects stroke, and also other organs can be affected. So various organizations, including international organizations, actually look at high levels of air pollution as a risk factor for heart attacks, heart failure, and of course, worsening of respiratory diseases.
Dr. Guleria, I don't see people wearing the N95 mask, and I personally believe that that's really our best defense against this dirty air at this point in time. Do you think that has to be normalized now? We've seen many other countries which have normalized wearing masks when people are outdoors, isn't it? What do you have to say about these masks?
Yes, so N95 masks do help people when you're going out and air QI is bad. It acts as one filter which filters out the particulate matter and doesn't allow them to enter the lungs. But it's important that you wear it properly. It should be tightly fitted around your nose and mouth, and you should be able to be comfortable with it. It's
Right.
something that helps, but I think that is for personal protection, but we also need to look at long-term solutions in terms of how do we control the source of emission, because this happens every year, and we are seeing this effect not only in the acute form, but the chronic effect that it is happening in to young children, to young people who are getting constantly every year exposed to high levels of air pollution.
Doctor, the fact is that cloud seeding is not worked in Delhi. Is that a bit of a disappointment there? Because I know that only for a temporary basis, it kind of settles the dust, but really doesn't improve the air quality in a big way. What's your take on this business of cloud seeding, which anyway has failed in the city?
So cloud seeding has not worked because it's dependent on multiple factors, including humidity as far as the air is concerned. Also, there has to be some degree of good wind velocity for that the air pollutants to move out, and it's only a
Right.
temporary measure. So, like I said, we need to find long-term sustainable solutions so that gradually over the next few years, we are able to bring air pollution down to acceptable levels, as has been done in many cities. This is a story which was seen in London. You had the London fog in the 50s, Los Angeles, New Mexico, and more recently, even in Beijing in China during the Olympics time. But because of good measures and strict implementation of legislation, they've been able to control air pollution. So I see no reason why we can't do it if we have that will to do it.
Three things, doctor, that you would like the administration to do instantly, three or five things that can be done instantly to help us, as far as this problem is concerned. And also, it's not just a problem, isn't it? Bad air is affecting us almost throughout the year, isn't it?
So that's true. So if you start looking
Yes.
at data, and there is data for the last more than 10 years, almost all days of the year, 70% of the days of the year at least, have air quality which is not acceptable. It's only during the monsoon months that because the rain, we find that air quality is better. The only time that air quality was better for the year was the year that we had the lockdown. Otherwise, if you look at the last 10 years data, we've had most of the year we've had bad days, and that is affecting long-term lung health, cardiovascular health, leading to dementia. There's a link with Parkinsonism, and more recently, there is also a link with cancers, which has been shown to occur in people who are being constantly exposed to high levels of air pollution is like smoking 8 to 10 cigarettes every day for many years.
Well, yes. Doctor, what should the government do on an emergency basis? How should this problem be treated to, on a war footing? I ask you this because when COVID happened, we saw everybody just wake up to this big crisis because people were dropping dead. I want you to reiterate on how maybe nobody is going to be dropping dead right now because breathing bad air, but it's going to have a very bad lingering impact on their health. And that's the reason why this has to be dealt with on a war footing. Which are the measures that instantly have to be taken to help us?
So we are very right. This is a silent killer, and we're having almost
Yes.
an epidemic or pandemic of deaths because of air pollution. If you look at the global data, and there's a report of the number of deaths in 2024, 8.1 million people died in 2024 because of air pollution, and that is more than the number of people who died because of COVID-19. So it does cause death, but it's a silent killer. We need to take measures to see how we can decrease the emission. So work on more public transport. How can you uh, push for people to become more environmentally conscious? How can they decrease their carbon footprints in terms of vehicular traffic? Public transport can be encouraged, and we need to see how each individual can contribute to what needs to be done in terms of decreasing the emission that is happening. It can also be as far as construction is concerned, road dust is concerned, or in terms of various emissions which occur through industry. This time, luckily, we've had less of stubble burning, crop burning that we do see every year, but something that also should be looked at in terms of the contribution to pollution.
Doctor, I want to ask you, which are the other things that, people like us should be doing on a daily basis to protect ourselves from the dirty air, apart from just wearing masks and N95 masks when we step out? What about children?
So, so I think children should be careful, and if they have to go out to play, I would advise parents to send them out only when the sun is out. Monitor AQI in your area, and if the air quality is bad, children and elderly people and individuals who have underlying heart disease or chronic respiratory diseases should avoid going out. If they have to go out, they should go out in the afternoon. Avoid doing a lot of strenuous exercise early in the morning or late in the evening, because then you're more exposed. And children should also be careful about playing out outdoors early in the morning or late in the evening, because when they play, you're breathing more rapidly, you're inhaling more pollutants, and that can actually affect the lung growth of children. So I think we need to be careful about exposure which is happening to extremes of age, that is children and the elderly.
And what about the use of filters, air purifiers? How effective are they? What kind are the most effective for our homes? What do you have to say?
So to some extent, air
Yes.
purifiers may help, but the data is not very strong in terms of their efficacy, and that's because most of the rooms or houses that we have are not sort of air are not sealed, or they are not sort of constructed in a way that air cannot come inside, and therefore there is constant movement of air from the room and from outside, and pollution will keep coming inside. Secondly, the efficacy of air filters or the air purifiers will vary depending on the size of the room and the capacity of the air purifiers.
Right,
So it may
right.
be useful to some extent, but I don't think that it's something which is going to make a big difference. And it sometimes gives people a false sense of assurance, which may actually not be there.
At the outset of this conversation, at the beginning, you did mention how China has handled this problem during the Beijing Olympics of 2008, I remember. Tell us, what were the steps that they had taken that we as a country can also take to deal with this crisis?
So I think you need to look at the emission. One is, of course,
Yes.
better push for environmentally friendly vehicles, better push for having green paths, encouraging people to use cycles, walk if they can, and develop facilities where it encourages citizens and they feel safe if they were to walk on. Because currently, even cycling or walking in many parts of Delhi is very dangerous. So can we make the city more environmentally friendly? If you look at many European cities, people actually cycle to work, and they are more tuned to walking, cycling, or using public transport. They don't
Right.
use that much of their own vehicles, private vehicles. We need to try and see how we can bring that into our own culture, and therefore decrease the emission that happens because of that. Secondly, look at how construction can be done in a better manner. There is a lot of construction which happens, and dust and pollutants are emitted a lot from construction. That also needs to be looked at. And other sources of emission like dust, which rises because of the cleaning that is done. And then I think another issue is that as winter sets in most colonies, you will have the security guards or individuals who are sitting outside start burning fires, and that also starts contributing. So I think it's a good idea if we could look at solutions like providing them with electric heaters rather than making them use the dead wood or to burn fires, because that also is contributing to pollution during the winter months.
All right. Doctor, I'm going to leave it there for the moment, and thank you for joining in with your views and your perspective and how effectively we can bit by bit try and find a solution to this problem, this health crisis that we have to deal with year after year. Thank you.
Thank you.